All right, guys, so I thought this would be a fun kind of way to do a video where I'm working out and we're talking. Might have seen by the thumbnail, today's video is going to be really just kind of giving a rundown of the US healthcare medical care system that we have set up that's currently running today. Kind of a how we got here rundown, you know, the history, why we're at where we're at as a nation in the US, and you know, maybe what we can do about it, how I'm thinking about what we can do about it, and kind of going from there. I'll probably get out of breath as I'm doing this, hopefully, we'll see. But you know, I think off the bat, I wrote this in my Substack article, you know, getting into this conversation could be pretty fraught. Talking healthcare is something that is off limits at family gatherings now. It's highly politicized. We'll talk about it's actually always been quite politicized, actually, funny enough. But at the same time, when you go to critique it, it can come off like you're critiquing, you know, the healthcare professionals, doctors, nurses, technicians. What we're going to discover here is that this doesn't come down to any one individual, especially not the people on the front lines, right? What we're going to talk about is how there is a system of corruption, a system that was not set up for not only us as patients, but also the people working in these industries. And so this is not a critique on them. I love our nurses, our doctors, our physicians. This is a critique on the system in general. And so, first off, how we think about medicine as it's currently practiced today is completely different than what it was back in the 1800s and even the early 1900s. You know, medicine was highly decentralized back in the late 1800s, early 1900s. You had lots of different philosophies, schools of thought around how medicine should be practiced. You had homeopathy, you had herbalism, you had biomedical, which is what we have today. But you just had lots of different schools of thought. And this is a double-edged sword because on the one hand, through trial and error and, you know, self-experimentation, there was actually some good things that came out of this. A lot of the herbs and supplements and things that we know work actually come from back when herbalism was a thing. But on the other end of that, you had a lot of quackery. You had a lot of snake oil salesmen, right? We've all seen the movies, the videos, the whole snake oilsman thing, the guy in the back of a wagon saying that cocaine, you know, is gonna fix all your ailments. And so, double-edged sword in that some good came out of it because self-experimentation led to some cool breakthroughs in figuring out what plants and herbs and maybe homeopathic Eastern medicine stuff actually worked, but then a lot of taking advantage of people, or just ignorance, honestly. Well, that all changed in 1910. In 1910, something called the Flexner Report was commissioned. Abraham Flexner was the head of this commission. Now, this is where we got to start talking about how did this all come to be. The Flexner Report was commissioned by the Carnegie Foundation. Now, the Carnegie Foundation was made by Andrew Carnegie. Andrew Carnegie, you can think of as like the modern day Jeff Bezos, Zuckerberg, any one of these billionaires today, right? He essentially started one of the first, I think it was steel mills in America, and then ended up selling it to JP Morgan, I don't know. Sold it for tens of millions, hundreds of millions of dollars, excuse me, the equivalent of like $11 billion today. So he was like the richest person in the country at the time. And so he created the Carnegie Foundation, which whole goal was to do philanthropy. All right, okay. Created the Flexner Commission, and the whole point of this commission was for Abraham Flexner to go out and take stock of our institutions, of our colleges, specifically in the medical field, and come up with a report, like what's going on out there. Well, Flexner came back and essentially reported that our system was, you know, woefully lacking in many areas. There wasn't a centralized way of teaching medicine. A lot of our institutions, colleges didn't have laboratories, weren't implementing scientific laboratory studies along with, their curriculum. Administration standards were very low. And he didn't like the fact that a lot of these colleges were also teaching, Eastern medicine or homeopathy or herbalism and other things. So, report comes out, Carnegie having all that money, Flexner being at the head of it. Dramatic shift happens. Within 1 year, over half the institutions in this country, colleges that weren't teaching specifically the biomedical model that Flexner wanted were completely shut down. And so, Flexner came up with, this is how everything should be done. We should only be teaching the biomedical model. Here's the curriculum that should be taught. Here's what our administration level should look like. All of it. And any institution that didn't want to change or weren't meeting those standards were put under. And, so right here is when now our current biomedical model that we use, that we see, was set in stone. Then Flexner, Carnegie, and we'll get into how John D. Rockefeller plays into this, our good old friend Rockefeller, picked out some of the top institutions at the time in the country that they kind of pegged to be at the head of the new medical school model. Yale, Harvard, Johns Hopkins. What they did is they told these institutions, hey, we'll give you tens of millions of dollars, equivalent of like hundreds of millions of dollars today, if you institute everything we're saying here. Biomedical, philosophy of medicine, the curriculum that we say, administration and teachers that look like this, etc. And here's the problem, right? At an individual level, it would be nice to say that if I get a couple $1 million dangled in front of me, if it doesn't align with my morals or my ethics, I would say no. At an institutional level, it's nearly impossible to say no to that, because you're thinking about, especially in the early years for these colleges, what that could look like for building new facilities, what that could look like for talent acquisition as far as teachers are concerned, right? And so you have these most powerful men in the world essentially saying, hey, we'll give you everything you want if you follow our guidelines. What'd they do? Of course, they acquiesced. Of course, yes, we'll do whatever you say, give us the money. And here is where the biggest problem arises. While a lot of good things came from this, centralization of medicine, one kind of guiding philosophy, end of quackery, higher scientific rigor, the roots of that tree are based off of the exchange of money. And this manifests itself in today, right? When the roots of the tree are moneyed interest, that evolution is always built off of that. So every new evolution in the medical sphere is built off of that one main root of there being this power lever, this money lever being pulled to tell institutions, you do this, we'll pay you, right? So that was the beginning. Well then, John D. Rockefeller, like I said, he was going to get involved. John D. Rockefeller, again, equivalent of Elon Musk in today's terms, right? He gets involved, not to be outdone by Carnegie, right? Rich people going at it, want to get involved. He started giving millions and millions of dollars to the General Education Board that was headed up by Flexner. And the idea here was that the General Education Board would come up with that curriculum, would come up with what is taught to our physicians, and again, the idea was we're going to dictate what is being taught, how our physicians and our doctors are thinking about medicine, how it's practiced, and that's based off of John D. Rockefeller's moneyed interest. Again, moneyed interest. So the curriculum is being set based off of one man's pocketbook, paying Flexner, who is in charge of the General Education Board. So you can see, right, how that system, the roots of it are just based off of two of the most wealthiest men in the country at the time. And again, a lot of good did come from that. Innovation, lots of great stuff has come from that. But also, like I would argue, the fact that it all started from moneyed interest is why we are still, or even in a worse place than we were back then today. So, okay, that's like individual money. So then what happens next? 1920s, the American Medical Association, kind of a bureaucratic association of physicians, assistants, medical practitioners, etc., had been around since 1847, but in 1920, they really took hold because they got involved, the whole same group. What they said is, hey, what we'll do is we'll set up a accreditation board. We have all the professionals, we have the people that have worked in the industry. We know what it should look like to accredit certain institutions to write off on these physicians are good to practice medicine, these ones aren't, and kind of what the whole process looks like going from a college to into the actual workforce as a doctor, as a physician, etc. So this is where bureaucracy starts to take hold. You have this big bureaucratic system coming in saying who can and who cannot practice, what that looks like, what colleges have the right to accredit, which ones don't, and again, money, right? You pay us, we'll make sure that your college gets accredited, your physicians, etc. And we know there's money and interest in this because the AMA really reared their ugly head in the 40s when President Ford tried to institute the first kind of nationalized healthcare, and the AMA put a kibosh to it. They spent millions and millions of dollars on the first kind of PR campaign to say that nationalized healthcare is socialist, a communist actually. It was straight up communist. And the reason for this was they knew that if the government took over healthcare, all of the money would dry up for them, for the General Education Board, for the colleges and institutions, for the physicians. That lever of power they now held would be taken away and given to the government. And of course, there's always an argument to be made that the government's not going to do a great job and they're going to have the lever of power. I'm not arguing that. But what I am saying is let's be clear on the reason why they fought back. It wasn't because they were looking after each individual and the patients. And no. They were looking after their own pocketbook and their own power structure that was set up. The government takes over power, we lose all power. What are we going to do? Where's the money going to come from? That's what happened there. They fought in the 60s against Medicare and Medicaid that Lyndon B. Johnson was instituting. And to this day, they're still one of the main lobbying groups in Washington, D.C. anytime this whole national healthcare, universal healthcare debate comes up. They want to keep the system as is because the system works for them. It works for the accreditation boards, all of it, right? So again, incentives, we come back to incentives. The incentive structure that had been set up in the 1910s and the 1920s is one of money, right? It was, how can we set up a system where exchange of money happens? And again, does that breed, innovation? Does that breed maybe higher quality? Yes, it does. I'm not arguing against that. But it also breeds, corruption. It breeds the selfish, the wealthy, trying to make sure that they make more. And again, we'll get into how that's really happening today and how you and I are suffering because of it. We can't talk about this without talking about the insurance companies. Insurance is an interesting thing. Got set up 1930s. Blue Cross was really the first one set up in Dallas. And the idea was employees could pay a monthly fee. That monthly fee would allow them a certain amount of hospital days, essentially. A very rudimentary version of insurance. A group of physicians kind of came up with it, and then they made Blue Shield. Blue Shield was the way that the physicians would be paid, right? So it was this idea that, hey, as physicians, we got to get paid, but we got to make this something where the patients can pay. So they came up with a system where, okay, you pay a monthly fee, we'll take that money, that's our pay, and then you'll get a certain amount of days that you get to come in. Boom. Insurance, right? So what happens is World War II. World War II comes around, and there are wage laws put in, essentially restraints on wages. Again, it's a war economy. And so businesses are trying to compete. They're trying to get workers. They're trying to, a lot of their workforce is overseas fighting. How do they incentivize people to come into the workforce? Well, if all of us have to pay more or less the same wages, what can we do? Well, there was no rules on offering healthcare, offering insurance, care to your employees. And so they were like, well, that can be an incentive. If we offer healthcare to our employees, we can't necessarily increase their wages. Maybe that'll be a way for them to come work for us. So corporations started doing that. It was not a law. It was just a thing that corporations decided to do, and it was like a quirk of the time. And as we know, it got entrenched into our healthcare system, and to the point now where like the IRS gives a tax cut to companies that offer healthcare to its employees. So the government did get involved with it, but it was just a quirk of the time. So like this isn't like some law or thing. It's just something that happened that we just continue to agree upon as something to do. And we know for a lot of people, and I know as a business owner and stuff like that, it creates a lot of headaches. It's not to say that it's not good for some people. It's just a question. Again, I love the idea of questioning. Like, where did this come from? Why do we keep doing it the way we do it? Is it a universal rule? No, right? So that's kind of the beginnings of the insurance companies. And then we can fast forward today. As we know, insurance is a billion dollar industry, right? It is completely privatized. It is for profit. And there's a lot out there these days about medical insurance. We have Luigi Mangione, that whole thing. The problem is again, I go back to incentive, is that the incentive for these insurance companies is to make as much money as possible because they're beholden to shareholders. Again, whether this is a conscious decision or a subconscious decision, we'll get into why it's a conscious decision. They're making decisions in ways to make sure they make the most amount of money, up and to the right. There's actually a former exec who worked for, I think it was Cigna, Wendell Potter. She was an executive. She kind of put the whistleblowing on the behind the scenes of what goes on in these insurance companies. They have an actual thing called the medical loss ratio. The medical loss ratio is a ratio of how many people they need to deny claims to so that they can still make a profit. So they actually have formulas made up, all this kind of stuff on here's how many claims we have to deny so we can claim profit this year so our shareholders are happy. Can you see how that incentive is just completely screwed, right? If the idea is insurance is there to help us when we need it most, to cover for us when our expenses are going to be the highest, but their incentive is to actually deny claims so they can make more money, we're at a crossroads here, okay? And so, we have United and Blue Shield, Blue Cross, all of these companies making billions and billions of dollars denying claims. Now they're using AI algorithms to make sure that they have denial claims up to like 80, 90%. Again, individually, there are great people that work in the insurance field that actually want to help people. But the system that they work in is not set up to help people. It is set up to make them more money, to make their shareholders happy, to make sure it's up and to the right. So our health, our wellness becomes an issue. And what happens is medical debt is the number one source of debt in this country. That is absolutely insane. What that leads to is people in debt, but it also leads to people just not seeking out care, right? If you know that you are likely to go into debt if you need to go to the doctor, you're gonna wait till the very last minute. You're gonna wait till you're incredibly sick to actually go. That's horrible, right? Instead of going and get something checked out early when you can maybe prevent something, you wait until something is stage 4 cancer. That's awful. And you're all because you're afraid of going into debt. That's a messed up incentive system that we have, right? It builds cynicism. I mean, how many people are just completely cynical at this point of our healthcare system, our medical care system, and our insurance system? A majority of Americans. And so now we lack trust in our institutions, specifically the institutions in the healthcare and the medical care industry. And we can see why, because we have whistleblowers coming out who work in the industry and say, yeah, this is the plan, guys. This is what we're doing. And so what ends up happening is America spends the most. We are a complete outlier with how much money we throw at our healthcare system, with the worst outcomes in all of the developed nations. We have some of the lowest life expectancy out of any developed nation. And again, we spend an exorbitant amount. I think it's like $13,000 per person in America per year on healthcare. That's insane. For us to just have the results we have, where people are dying, infant mortality rate is incredibly high. Mother, mothers giving birth, death rate is one of the highest in the world, including third world countries. That's absolutely insane, right? And we can get into hospitals, right? Hospitals, a lot of hospitals are for profit. Even the nonprofit ones, they're making a profit. And so what's their incentive? Well, if they're for profit, their incentive is to have beds filled, write prescriptions. And here's the effed up part, is hospitals know in America that the insurance companies, to some extent, are gonna cover some of the costs for the patient. So what they do is they upcharge an IV bag 10x because they know they can, because they know the patient's not gonna really pay for that, it's gonna be the insurance company, so then we'll make money from the insurance company paying that off. So we'll just charge 10x. So here in America, again, like an IV bag costs a couple $100, if not more. I haven't looked at the going rate of an IV bag, but I know in Europe and other maybe socialized healthcare places, it's like 10 bucks or free. Why? The system. The incentive for these structures and systems is to make more money, so they're figuring out ways to do it. And so this system works great for most of the people in the system. It works great for the insurance companies, it works great for the hospitals, for administrators, for the C-suite execs. Who it doesn't work great for is the people it's supposed to take care of, you and I, right? And this, we haven't even gotten into big pharma yet, right? As we sit here today, big pharma is probably the final boss of the healthcare industry. They have some of the biggest hands in this industry out of any of the ones I've talked about now. They are hundreds of billions of dollars worth in companies. Pfizer, Moderna, J&J, you know the names. It is so rampant, the corruption that these pharma companies have. They are the number one lobbying group in the country. I think they're number one. Last I checked, they were number one. They spent, in 2021, $600 million lobbying against regulation on, and I think this was Biden, 2021, on Biden trying to regulate some of the pharmaceutical prices. And the deal with this is, America spends the most amount of money on pharmaceutical drugs out of every other developed nation. Because again, the government has done nothing to regulate the pharmaceutical industry because, again, they spend hundreds of millions of dollars to make sure they don't get touched. They also spend hundreds of millions of dollars on the FDA specifically. 45% of the FDA budget comes from the pharmaceutical industry. Literally the people that they're trying to regulate. It's like the fox guarding the hen house. This is called regulatory capture. It's a big problem in our country. And so we have this whole pharmaceutical industry that's paying off our politicians, lobbying to make sure that their bottom line doesn't get touched. And then what they do is they wine and dine our doctors. They take them out, they show them all the new cool drugs, medical devices, and they tell them, hey, you know, you write a script for our drug, here's a nice little check you're gonna get, a nice little kickback. Again, who can blame a doctor who has hundreds of thousands of dollars in medical debt, who is working their ass off in a system that was not set up for them or for us, seeing patients 10 minutes at a time, coming home burned out to their family, all of their money, while they make good money, is just going to their debt. They have a pharmaceutical rep come in and they say, hey, who can blame them for taking that? Again, the incentive structure. I understand, I don't blame a doctor for that at all, right? I get it. But then these pharmaceutical companies also go into our college institutions. And while our doctors, our physicians are going through residency and everything like that, they have these pharmaceutical reps coming in and teaching them curriculum on what to look for on tests, how to diagnose, so that they can prescribe their specific drug. That's insane, right? A lot of the curriculum that is taught to our physicians and doctors is actually just around drugs. What drugs do what drugs to prescribe when, side effects, etc. It's, you know, yes, there's a lot on physiology and all of that for sure, but a lot of it's also just on drugs because, again, the pharmaceutical industry has their hands in it all. And from the education to the implementation to the politicians. And now, this is not to be, again, I mentioned Luigi Mangione. This is not to be Luigi Mangione and, you know, we need to tear the system down, we need to do all that. That's not what I'm saying. It's just to give a gross oversight that what we have here is a system that was built off of moneyed interests. We have an incentive structure that, in my opinion, is backwards. There are some things in this country, I love capitalism, I'm a business owner, but I have a belief that not everything needs to be capitalistic or the incentive needs to be money. Because listen, at the end of the day, if we're talking about health, medical care, if the incentive was actually health and helping people, you're gonna have down months. You're gonna have months where you need to spend more money on certain things to take care of those people, and that's okay. Because that system should be set up for the one underlying thing, it's taking care of us, right? And it's no wonder then why doctors, right, are not set up to understand how to do preventative health care. One, the biomedical model doesn't really look at preventative health care as a thing. That got kiboshed back in 1910 when Eastern medicine was thrown to the side. And then again, their incentive is, I gotta look to diagnose so I can write prescriptions, so I can make some money, so I can pay off my medical debt. And so we're in this system where, you know, we are kind of let out to dry, more or less. We are let out to figure it out ourselves. Many people don't seek medical care until it's way too late. Many people do seek out medical care, and they have something like an autoimmune disease or, you know, a non-diagnosable disease or something, and a doctor doesn't know what to do. They have terrible symptoms. They feel tired. They can't perform their daily life. They hate their life, and they're being told that there's nothing wrong with you. And then if you advocate for yourself, you're deemed a difficult patient or, you know, a quack, or if you're gonna go do your own research, who are you to question a doctor, right? And so we just have this system that is set up for us, the individual, to fail. And that's why I'm doing what I'm doing with Stellar Health Awakening. It's why I'm making videos like this, just trying to educate people on the medical system. Why I'm gonna be doing one-on-one coaching where we do use functional labs. Labs that a lot of doctors would not even know about or never use because they're not gonna be able to diagnose anything. And that's the thing, we're not gonna diagnose. We're gonna look at these tests to build out a holistic view of what's going on with you biologically, and then we're gonna bridge that gap with your actual lived life experience. Because at the end of the day, we want you to, if you're experiencing symptoms, get better from those symptoms, and then live a better quality life for as long as you can. And we care about that more so than any other incentive. We want to help people, and that's why I've created Stellar Health Awakening. And we can kind of see like this system that we're working in America was meant to keep us sick, because us being sick means that all of those systems I just talked about, they keep the money and the cash flow going, right? If we get healthy, that system starts to collapse. That's what I'm here to do. I'm here to help us get healthy. So if you guys enjoy this stuff, if you're loving the awakening, if that kind of felt like taking the red pill a little bit, very gross overview. If you want to do more research, you can. If you want to read the Substack article, it's probably more in depth than what I did here, but go read the Substack article. Check us out, Stellar Health Awakening there. On Instagram, Stellar Health Awakening. I'm starting to open up the wait list for coaching, so if you want to do that, comment down below, send me a DM on Instagram, and I can put you on the wait list for coaching. Anyways, I'll see you guys in the next one.